The COVID-19 pandemic has been disrupting the lives of billions across the world. Yet how refugees and immigrants are coping with the situation has been grimly reported. Weave Tales has partnered with Florida Immigration Coalition and We Are America to find out how these communities are dealing with the epidemic through the voice of their leaders and to discuss what needs to be done for now to better protect their lives.
Okay, well, my name is Indira Morin. Most people know me by Indy. I am originally from Chile, South America, and I had been in the United States for a little bit over 40 years. So I had lived in this country longer than I lived in my own. So I'm an immigrant, and I have a long way of stories to tell about my life as an immigrant here, but most of them are very successful. I had been here in Florida now approximately about 16 years, and I had been quite involved with the immigrant community, doing all sort of events and meetings and trying to help the community, especially with language issues, housing, economical situations that they have, encountered throughout their lives. How my direct contact with them is to give them information, resources in the community. And along the way, I have met wonderful people like yourself, Basma, and people that we have come together to create this network where we can help others to obtain whatever the needs may be. I'm currently working for a law firm that works with immigrants, although my job is not directly with the community that we serve, but we have other connections with the community where we do outreach of some kind with the attorney I work with. I am right now, I'm at home. I'm isolated, and I think it's a good thing because it's truly, we don't know much about this virus. And until there is a vaccine or a cure, I think it will be safe to say that we need to stay away from meeting other people or having that close contact we're used to. I know that these have had high toll on people in general. I am a very social person, so these had affected me directly because I can't have those contacts, direct contacts that I had before. However, thanks to the digital world, I haven't been able to keep these relationships alive. However, emotionally, I can have downtime where I feel a bit of not useful, if I can use that term, because again, I don't have that contact in the community. I'm used to be out there in the trenches, serving people, helping people, and because the danger that I could get this virus, it kept me away from going out. So I'm trying to be as active as possible with what I have, which is digitally, but I can't go out in the community where I live to help directly to them. We receive daily several phone calls from people who have been detained. And you're correct, ICE has not stopped from doing their job. And in times like this, I think this is very dangerous, not only for the officers, but also for those individuals that are caught and put into these jails with other individuals that perhaps are not infected, and those new ones that come in could be carrying the virus. So it's a very dangerous situation. We we do know that, or I do know that calls are coming in. I'm not directly focused on answering the phone at the office, but I do know that calls had come in from desperate families trying to see how our attorney can help them to go through the process of getting them out, or trying to find ways to help their families throughout these horrible times. I'm dealing with my own issues of disconnection due to the situation, and I do feel a little bit useless, like I mentioned to you, which is it's not a good way to feel. But in the community, what I have heard, because I contact some people that are directly contacting families, my understanding is that the families are currently, they have what they need, but they know that soon they're going to be in need of replacing what they already have. So that creates a little bit of anxiety in the community. And also, those who have children at home and they cannot go to work because they can find the care that they were receiving, whether that is through Head Start or Early Head Start. Those parents are no longer receiving this free care for their children, so they have to be at home. So, if they are not already, unless they have family members who are helping them, I'm pretty sure that these families will be dealing with the devastation of not having any more food to eat, or will have to figure out a way that they can go back to work or find a job that will provide so they can buy food. So that's my understanding. In the essential things that they are missing, some of them are diapers, some of them are utensils to keep their house disinfected. Those are very hard to find right now. I don't know when they're planning to replace those in the stores, but they are encountering these things. So they bring this sense of helpless and anxiety, because they now are running out of ways to keep their home safe for their families. So there is a degree of anxiety, and of course they bring depression because they cannot. And I'm saying I feel unuseful because I can't go outside in the community, but I can imagine to feel that way because you can't provide for your family. But the people I have contact, they're telling me that there is no place for them to go and find, let's say, for the food pantry. At least here in Clay County, and I live about 8 miles from north from Green Cove Springs. They have a food pantry that serves a large community here in Clay, and I understand they have a system in place, like giving vouchers to those families before they go and pick up, and these vouchers are usually issued by organizations like, let's say, Head Start, and then once they get the stamp from Head Start, they go and claim the food that they can receive. Now, having those entities closed, I do not know if they have removed the voucher for people to use, but my understanding that they are receiving foods for people to have, but in general, I do not know for sure how the community is coping with the lack of work. This area where I live, also there is a lot of small business owners, and these small business owners are either closing or trying to apply for that small business administration to get that loan that the government had approved, and to be able to survive and maintain those employees, which are the families that live here. So there is a catastrophe going on when it comes economically, and I know this is affecting all of us. Yes, there is currently also, we are recovering from a political turmoil that happened, as you recall last year, until now, and they were going to have an election, right, to vote to change or amend the constitution in Chile. But I don't know, I think those right now have been put in halt just because of the situation. But my understanding is Chile currently is not suffering like a high number of COVID-19 infections. It's coming. We all know, again, if they close the country, I know that there are some martial laws that they have put in place to protect their citizens, but it seems like they are all very sporadic. They are not what the people want. And then again, I know people are not going to be satisfied no matter who you are or what you are. But I think that there are some measures in place to protect the citizens. And but there is a lot in the confusion of the political, environment that is happening right now. I think that there is a lot going on with that as well. Far as I know, the last conversation I had with my brothers and some of my nieces is that the policies that are in place are not the greatest to protect the country citizens. But the death toll is not high. So I'm assuming that because they put all of these barriers for people to come in, and then the people not to go out may have restrict a little bit the, infection or infecting each other. But I do not know in details what they do have in place. I only get what I get from people that I speak with. What the community is doing, as I mentioned earlier, I think because this area is sustained economically mainly by a small business, I think there is a lot going on and done to support those businesses. I know the stores are open in here. I do know there are some small businesses that they are at the verge of, break point. But I think the economy is something that they are trying to save. Again, I think that when it comes to make a decision like this, right, they have to look at the whole picture. But within Clay County, we have 3 cities. And I know the Green Cove Springs, Orange Park, and also Keystone, they're all part of Clay County. They are working together at keeping, along with the executive orders given by the governor, DeSantis, and trying to protect people. Now, I can't go out because I choose not to go out, but people are going out, and I think people need to stop doing that. So there can be some regulations in place, but if people are not taking this seriously, this is going to take us longer than we expect or we like to. I certainly don't want to be stuck here at home, unable to go out. But I also think that people need to take this seriously. For those who are not taking it seriously, they should. And with the orders from the governor, I think that while they are, in my opinion, they are not as strict as it should be to protect the citizens. People should make, if it's voluntary, to make the decision to stay home. Because again, without our leaders giving us the laws or the regulations and be meaningful about it and intentional about it, this is not going to get over with. In Clay County currently, while it has, I think, a total, it's not as high as Duval County, the infection, but it's growing by day. And also the death toll in Clay County is high, and not as high as Duval again, but we are right next door. So I think we need to take this seriously, and we need to have our leaders in the community, as myself, to encourage the people take the measures to protect their families and themselves. Refrain from being outside if we don't have to. That we can all do. Obviously, it's a choice. But if we don't follow through, it's going to continue being at the level that it is right now. I think what we lack sometimes, like you said, are the resources in some of the communities around the world, including water. Our water sometimes is worse than, the virus itself, because they are not potable water. They haven't been processed, so people are scared, right, to wash their hands. But I think that there are other mediums to do that. In globally, I think that those countries, like the ones that they have brought down the infection of the coronavirus to a level that they can handle, perhaps they can help those other countries that they are in need of, whether it's mask or hand wash, or even, the communities that they are currently living, the refugees living in tents. I don't know what it is to live in that situation, but living in these cities made of tents, it attracts a whole bunch of other stuff. So people are vulnerable, and that they are more keen to get sick, and definitely don't have the health care accessible to them, and they are going to live only on what other countries may have left or in donations. And I think that we should have or make a bigger effort to help those. Now, when it comes to the undocumented immigrants, sadly, as far as I know, there is nothing to protect them. I mean, they can do what we are doing right now, which is, wash hands, protect themselves. But these individuals are going to work every day so we can have food on the table. These people are working their tail off, and nobody's recognizing their work. Being undocumented doesn't mean that you are unhuman, that you don't have rights. As a matter of fact, in this country, whether you have documents or not, you have rights. And I think we should make an effort on solidarity to these workers, to these families, that they are making sure that you and I can eat. They should have access to some kind of relief, economical relief, so they can, keep their oftentimes U.S. citizen children, with food on the table, and able to continue growing. Some of these children, if they don't eat, they're going to have health issues and learning issues, and they need to be able to have access to food that it will continue helping them on their growth. Some of these families have babies, and if these babies are not being fed properly with the right food, they're also going to have possibly learning disabilities that eventually we're all going to pay for. So we need to be proactive. We need to be able to help these families to receive some kind of relief to help them go through this horrible situation. And I don't know, other than having maybe Congress, I'm not sure about the Senate, but the Congress, or even their own state legislators, to come up with some kind of relief for them. At our pressure, we have to be involved to be able to, get those kind of help for them. Because at the end, it's going to be also good for us, because if we are going to have children that they are going to have learning disabilities, let's say, at the long run, these children may have to live on what, public help. And that is something that it comes from us. So we have to think on those terms. We have to think into the future, because these children were born here, and some of them are born here, if not the majority of them. So we have to make sure that our children are taken care of as well.